The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Thank you so much for joining us for the 12 Points October webinar. We have a really special one this week, and we have two excellent guest experts who will walk you through all the ins and outs of Social Security and Medicare, respectively. As usual, we're just going to give everyone about 30 to 40 seconds to kind of log in, get settled, and then we'll be right back. Looking forward to hearing from you soon. All right, everybody, thank you so much for joining us. So today we're going to be talking about Social Security and Medicare on the 12 Points October webinar. And we're going to get into two expert panelists who have been gracious enough to share their expertise and their time with us today. And we'll walk through each of those individually and kind of walk through each of these topics in great detail, hearing from them directly because they are just truly leaders in this space, and I think they have a tremendous amount of knowledge that everyone can benefit from hearing from. So we'll just go through my bio briefly. My name is Dan Sharkey. I'm a senior relationship manager here at 12 Points, and I'm going to be the moderator for today's webinar. Fortunately, you won't have to hear much from me. Really, we're joined by two experts, and they're really going to be the voices that are going to carry us today. And if you have any questions, we can certainly direct you to them. When we complete, we'll have all their contact information and everything else that you would need to know to get in touch with them directly or to ask them any questions that pop up as a result of what we talk about here today. So first is Lori Howe. Lori is probably the foremost expert in Medicare that we deal with here at 12 Points. She's an absolutely excellent resource given the complexities that you are likely to see, and we'll make sure that we have all of Lori's contact information here as well. Lori's going to go first, but I also want to introduce Allison Doroski. Allison is with LifeYield, and she is really our Social Security expert. LifeYield has an excellent tool as well as other tremendous resources for anyone who has questions about Social Security. Obviously, Social Security and Medicare are not easy programs to navigate, especially given deadlines, when you can enroll, et cetera, and we'll be sure to touch on all of those topics here today. If you have any questions at all, just a couple of housekeeping items, please feel free to use the chat box. I'll be sure to monitor any of those questions that pop up, and we'll also, set aside some time at the end for anyone to ask specific questions about any of the topics that we cover. Also, too, we're here for probably about 30 to 40 minutes. I know we're probably booked until 1, but we'll try to get you out earlier so that everyone can kind of go on with their day. So first, we're going to talk about Medicare. Lori is our expert here today, and Lori, thank you so much for joining us. I wanted to start basically with kind of giving a general overview of kind of exactly what Medicare is, what the 4 parts here that we can see on the slide, what they entail, how they interact together, and just the overall kind of high-level view of what people should be thinking about when discussing and having to enroll in Medicare.
All right, great, thank you. So Medicare is your healthcare coverage when you turn 65 and older that has been subsidized by the federal government. So what's been happening as you've been working, you've been contributing into Social Security, and part of that money is going to the trust fund for your Medicare coverage. So when you turn 65 is when you first become eligible for Medicare, and that's when people start getting things in the mail saying, it's time to enroll in Medicare, or these are all the plans that are available. So that the 4 major parts of Medicare coverage are Part A, hospital coverage. Part B, the medical coverage. Part C, which are Medicare Advantage plans, and Part D, which are prescription drug plans. So I'm just going to go into a little more detail on those. So Part A is the hospital coverage when you're an inpatient admitted to the hospital. So Part A will cover the cost of the hospital, the majority of the costs. There are some costs which we'll go through in the next slide, and has some skilled nursing facility coverage too. But you have to be admitted as an inpatient for the Medicare Part A to provide that coverage for you. Medicare Part B is for your outpatient care, so your doctor's visits, medical testing, injections that you receive in the doctor's office. Those are all covered under Part B of Medicare. So Part A and B together are called original Medicare or traditional Medicare. So when you hear that phrase, that's what they're talking about, Part A and B together. So because Part A and B does not have comprehensive coverage, the other parts of Medicare have been added to original Medicare to give you more complete coverage. One type of coverage is called Medicare Advantage plans, also termed under Part C. So Medicare Advantage plans are network-based plans, typical to like the employer plans that many people are familiar with. They're HMOs or PPOs, so you get your care within a network of doctors and hospitals. The Medicare Advantage plans often have prescription drug coverage and other little benefits tied to them. But when you're looking at the coverages, you have to make sure that your doctors and your prescriptions are covered by the Medicare Advantage plan. Part D plans are just prescription coverage. So it's only the prescriptions you can get filled at the pharmacy. Those are covered under your Part D plan. So when we think about A plus B plus C plus D, that's not how it works with Medicare. All those pieces together do not give you more comprehensive coverage. It's actually an either or situation. You either get your Medicare coverage with original Medicare Part A and B and add Part D prescription drug coverage to that, or you get your coverage via a Part C Medicare Advantage plan. Now, unlike Part A and B, there's only one Part A, there's only one Part B. There's multiple Part C plans and there's multiple Part D plans. And what plans are available to you is based on your zip code and county that you live in. So for example, for Medicare Advantage plans, Part C plans, in Norfolk County, there are 26 different Medicare Advantage plans to choose from. In Norfolk County for Part D plans, there's 23 different prescription drug plans for people to go through to determine what is their best coverage. And one option that isn't listed here are Medigap supplement plans. So Medigap supplement plans only work with original Medicare Part A and B to give more comprehensive coverage to Part A and B. Medigap plans don't have prescription drug coverage, so you still have to get Part D plan for that. So this is where many people run into problems and make costly mistakes, is that they don't realize how many Part C Medicare Advantage plans there are and how many Part D plans there are that have to be analyzed to determine the best coverage for you, because they all have different lists of prescriptions they cover. They all have different networks of doctors. So that's really where people tend to start getting into trouble. And then with Medigap supplement plans, there's also 21 different Medigap supplement plans available in Massachusetts. Other states have different rules. For example, Connecticut has 92 different Medigap plans to go through. So the rules are different for Medigap plans based on what state you live in. So it can get really into the weeds for people, and oftentimes, you know, someone will ask a friend or a relative, what plan are you on? That plan might not work best for you because it depends on your prescriptions and your doctors, what really is the best plan for you.
Right, and that's actually a great point. And so a follow-up question that I would have is, so people really need to be mindful if, for example, they move in retirement or you know, move once they're already in Medicare, because there is a potential possibility that the plan they're currently on is not available in their new county and by their new zip code, correct?
That is correct. So When it comes to prescription drug plans, the Part D plans and the Medicare Advantage plans, the Part C plans, those are strictly based on your zip code and county of your legal residence, what plans are available. As far as Medigap supplement plans though, once you're enrolled in one, you can keep it even if you move to a different state. So those are transportable. And it's actually very good to keep your Medigap plan because the rules are different in another state. So for example, if you get your Medigap plan in Massachusetts, you move to Texas, you can keep your Medigap supplement plan. But if you want to look at plans that are available in Texas, you can look at the plans, but Medigap plans in the state of Texas do not have to sell you a plan. They can ask you medical questions to see if you are a good candidate. If you have any pre-existing conditions, they can either deny selling you a plan or they can put you in a waiting period.
Okay.
So there are different rules on different states. Massachusetts has one of the most friendly options. We can enroll in a supplement plan at any time. There are no medical questions asked, and we are community rated, meaning everyone in the state pays the same amount, not based on age, not based on gender. Those rules are different in different states.
Okay, that's really helpful, and I believe I kind of failed to mention this at the beginning, but Lori runs How Medicare Advisor LLC, so we'll make sure to have all her contact information because really, out of all the guests that we have had on these webinars, one of the most knowledgeable people in her field. Now, Lori, are you able to advise clients across state lines? Can you just talk a little bit about how that would work, and if someone was looking to engage your services, are you primarily Massachusetts based, or do you have an ability to help people across the country?
I can help people across the country. I don't sell insurance. So I am licensed to sell insurance, but I've made a conscious choice not to contract with any insurance company. So that gives me the flexibility and ability to look at all the plans that are available for clients, no matter where they live.
Really, really helpful. It's such an interesting and complex topic. And you touched on one other thing that I just want to comment on, and that is people talking to their neighbors or brother-in-law about what coverage they're currently using. And that's something that we discuss with clients all the time, is that whether it's other topics in financial planning or something as complex as Medicare, you really have to do your own due diligence about what plan is suitable for you, regardless of what others are doing. You know, what's good for your neighbor isn't necessarily good for you. So would you be able just to touch on some of that idea that, you know, it really depends on your personal circumstance to really find the best coverage for you personally?
Sure. So one question I often ask to my clients is, do you travel? So a number of my clients do have multiple homes, you know, based in Massachusetts or Florida. And they want to be able to see doctors at both locations. So if they are with a Medicare Advantage plan, those are network-based plans. So if you are in Florida, you're out of your network area and you will have out-of-pocket costs that are higher. If you have a Medigap plan, you can go to any doctor that accepts Medicare. You can go to any hospital that accepts Medicare. There's no networks to worry about. Another concern I have is with people's prescriptions and their diagnosis. So unfortunately, if you've had a cancer diagnosis or you have very high cost injections that are in a medical setting that you receive them, the Medicare Advantage plans would charge you 20% of the cost typically for those injections or cancer treatments. If you have a Medigap supplement plan, those work with Medicare Part A and B. A lot of the injections are covered by Part B of Medicare, and the Medigap supplement plans would cover the 20% that Medicare doesn't cover. So it depends on people's diagnosis, their prescription coverage, really what's the best options for them.
Excellent. No, that's really good to know. And again, everyone it's different. So really helpful to really get some thought as you go through.
If you can just give me a call back when you receive this at 855-788-2248. I'm not sure that you received the notice that just went out recently. It's Mia Torres. If you can
so let's just go over here. You know, a big concern that people have are the costs of Medicare. So we have a slide here that kind of highlights, some of the standard charges that they're looking at. So could you just walk through this and describe to people what expenses that they're likely to face when signing up for Medicare?
Yeah, so unfortunately, it's still the 2021 prices. They typically release the 2022 prices in early November. So we're just going to base this right now on what we know, what the prices are. So with Part A of Medicare, so once again, that's the hospital coverage of Medicare, there's a $1,484 per benefit period deductible. And I have the per benefit period in italics because I want to describe what that is. So once someone is admitted to the hospital, they're responsible for the first $1,484 in cost. Once you've met that deductible, then Medicare covers the remainder cost for up to 60 days. Once you've been admitted to the hospital, that's when your benefit period begins. Your benefit period ends once you've been discharged from the hospital and out of the hospital for 60 consecutive days.
Okay.
If by chance you should go into the hospital on day 63, even if it's for the same reason you initially went into the hospital, unfortunately that starts a new benefit period and you're assessed another $1,484 deductible. So you could potentially have multiple benefit periods within a given calendar year.
Okay.
So that's one of the major gaps in Medicare coverage. And then Part B, everyone has a Part B premium. The standard Part B premium for 2021 was $148.50. But if you are higher income, that impacts your Part B premium. So there is a chart with thresholds of your modified adjusted gross income. So Medicare and Social Security looks at your modified adjusted gross income from 2 years prior. So in 2021, they were looking at your 2019 tax return to determine what your Part B premium will be. So there are different thresholds, and based on what threshold your modified adjusted gross income falls into, you will be assessed what's called IRMA, or income related monthly adjustment amount. So this is a surcharge that they add to your Part B cost and your prescription drug cost. So unfortunately, people who are higher income do have to pay a higher amount for their Part B premium and their prescription drug cost.
Okay.
And then with Part B, there's also an annual deductible. So this is just a one-time annual deductible. It doesn't have benefit periods. So the Part B deductible for 2021 was $203. So once you've met the Part B deductible, then Medicare covers 80% of your costs, but you're still responsible for 20% of the remaining costs with Part B coverage. So that's why many people pick up Medicare Advantage plans or Medigap plans to help cover some of these costs.
Okay.
Now, once again, Medicare Advantage plans, the costs for those are, there's multiple Medicare Advantage plans, there's multiple prescription drug plans, and their costs can vary on where you live in the coverage. So for example, with Part D plans, I know the lowest monthly premium Part D plan is $7.40 in Massachusetts.
Okay.
The highest plan is $120 a month. So there's a great variety of options and costs with the Part D and Part C plans. And then once again, Medigap plans, there's different levels of coverage and there's different price points for those different levels of coverage.
Okay, really helpful. So let's just go through some of the common questions that that most people have when discussing Medicare. So I'll kind of go through these one by one and just allow you to respond given your level of expertise. So if you're turning 65, do you have to enroll in Medicare?
All right, so the answer is no. So this is where actually we have a lot of issues with the ages for Social Security, and I'm sure Allison is going to touch upon this, and the age for Medicare. So when you turn 65 is when you typically become eligible for Medicare. Unless you have a disability or if you have Lou Gehrig's disease or end-stage renal disease, you're eligible for Medicare as soon as those diagnoses are made. If you are collecting Social Security disability income prior to, for 24 months, on the 25th month of that, you become eligible for Medicare. So, but the standard eligibility age is 65. If you are collecting Social Security prior to turning 65, you will be automatically enrolled in Medicare. Other than that, the onus is on you to reach out to Medicare when you're turning 65 to enroll in Medicare. So Social Security is sort of the gatekeeper for Medicare.
Sure.
They control, when and how you can when you can sign up for Medicare. If you are actively working and you're covered by the group health plan of your employer, and your employer has 20 or more employees, you can delay enrolling in Medicare. You don't have to enroll in Medicare when you turn 65. That way, your employee group health plan would still be the primary payer of your health insurance. So people can do that if they're still actively working, covered under the group health plan of their employer, and there's more than 20 employees, you can delay enrolling in Medicare.
Okay, really, really helpful. So kind of one of the bigger questions that we get all the time is that people do not realize that there is a cost associated with Medicare. So we touched on that on the previous slide. So question 2, no, Medicare is not free. When you enroll, I'll just expand that question a little bit. Are the premiums due immediately, or how can clients and enrollees expect to actually submit their payment for these costs?
Okay, so let's touch on something first. So with Medicare, you become eligible for premium-free Part A of Medicare if you've been working for 40 quarters contributing to Social Security. So Part A of Medicare, for most people, has no cost. If you have not contributed 40 quarters to Social Security, then there is a Part A premium also. So there could potentially be a Part A. There's always a Part B premium for people. You don't start paying the Part B premium until you enroll in Medicare. So you can delay, and that's why some people do delay enrolling in Medicare if they're covered by a group health plan, because why pay the Part B premium if you don't necessarily need it because you still have your health care through your employer? So I'm not sure if that answered your question.
No, that's exactly right. No, and again, this is where it gets very complicated. And I would urge everyone who is listening to reach out to Lori directly, because even the complexities, and she's so eloquently describing what you need to do, it's still very, very confusing. So for anyone who has additional questions about how your personal situation may fit in, Lori's a tremendous resource. So number 3, if Part A is free, can I enroll in Part A even if you're still working? I think you touched on that briefly, but just a little more on that would be helpful.
Yeah, so you can enroll in Part A of Medicare, if it has no cost to you. Many people do that, but there is one caveat to that. So if you are still working and you're covered by your employer group health plan and you are contributing to a health savings account, you should not enroll in any part of Medicare. The reason is, once you're enrolled in Medicare, whether it be Part A or Part B, you can no longer contribute to a health savings account. And if you by mistake continue to contribute to a health savings account, the money put in there is treated as ordinary income and you will be taxed on that.
Okay.
So for people who are delaying enrolling in Medicare, Part A and Part B, once you've decided your retirement date, if you've delayed enrolling in Medicare, then you have to back out or stop contributing to a health savings account 6 months prior to when your Medicare becomes effective. The reason for that is when you delay your enrollment into Medicare, they always go back 6 months retroactively in your Part A coverage. So by going back 6 months retroactively, they might be capturing money that has been put in a health savings account. So you have to really be careful about how much you're contributing the year that you're planning on retiring.
Okay, and that's really helpful, especially for high earners who are utilizing health savings accounts as a retirement tool. It's really important to be mindful that that is a common planning technique that we utilize for clients. So that's a really important point about the health savings account. let's talk about completeness. So if you're enrolled in A, B, C, and D, it's kind of the alphabet soup of Medicare. Can that be defined as quote unquote complete coverage?
No, because all the parts of Medicare don't work together. So for example, if you have to have Medicare Part A and B. You have to have Medicare Part A and B to enroll in a supplement plan. You have to have it to enroll in a Medicare Advantage plan. Part D, you don't necessarily have to have, if you've had creditable drug coverage, such as through the VA, you do not have to enroll in Part D, but most people do have to enroll in Part D. So how that works is A and B are together. You can add a Part D plan to that, or A and B together and add a Part C plan to that. So you can never have a Part C plan and a Part D plan in place together. They actually cancel each other out. So for example, if you were enrolled in a Medicare Advantage plan, a Part C plan, and then enroll in a Part D plan, not knowing that you can't work both, it automatically cancels you out of your Part C plan. So not all the pieces work together.
Really helpful. And this is the last question is, I feel like, is very timely, considering that what everyone is calling the great resignation, with people changing jobs at a record pace, people being laid off due to COVID and all those other restrictions. But COBRA has become a very popular topic. So if I have COBRA, don't I already have health coverage even if I'm over 65?
No. So the reason being is that COBRA is not considered coverage through active employment. So what protects people from being assessed any penalties through Medicare is if they're covered under employee group health plan under active employment. COBRA is not coverage under active employment. And there's different rules for your COBRA coverage based on if you are already enrolled in Part A of Medicare, or you're going to turn 65 while on COBRA. If you are on COBRA and you're turning 65 while on COBRA, you will be automatically dropped from your COBRA coverage.
Okay.
If you are enrolled in, say, Part A of Medicare because it had no costs, and then you lose your job or retire and offer COBRA and you accept COBRA, that's okay. And you can enroll in Part B of COBRA and you can still keep your COBRA coverage. The problem with COBRA and Medicare also is actually with the insurance. So the COBRA insurance companies specifically work secondary to Medicare. So the COBRA insurance plans expect you to already be enrolled in Medicare when you're 65. So if you are not enrolled in Medicare, you're going to be responsible for what costs Medicare would have covered if you had been enrolled. And COBRA covers secondary. So COBRA is always secondary to Medicare coverage. So unfortunately, people elect COBRA, they don't enroll in Medicare, and then they start getting bills, and they're not, they don't know why. Well, that's because they're not enrolled in Medicare. Medicare would have been primary, COBRA would have been secondary. And then if they've, missed their opportunity to enroll in Medicare, you have an 8-month window to enroll in Medicare once you've lost your group health coverage. But if you don't do it within that 8-month window, then your Medicare, you won't be able to enroll in Medicare until the general enrollment period, which is January to March of every year. And your Medicare would not become effective till July of that year. So people can potentially have a year's worth gap in coverage. So, the rules for COBRA are very tricky with Medicare. So, if anyone's in that situation, please reach out so we can avoid you having any problems.
All super helpful. And if there's one thought that I'll try to leave everyone with is basically two things, and not specific to Lori's expert guidance here, but timing really does matter. Please don't make any assumptions, and try to really think about your own personal situation and not rely on information that you heard from, cousin Susie or Uncle Sam or at the grocery store. There's so much, and I believe, Laura, you touched on it earlier, even as it relates to parts A, B, C, and D, there's so much misinformation that's out there that to really do this the proper way, you really have to understand exactly what you're signing up for. So we really appreciate it. We are going to turn to Social Security right now, but I will make sure that Lori's contact information is at the end of the presentation, because I would really urge you to reach out to her directly for guidance. This is a very important aspect of the very important government program, and it's going to impact you significantly. And having someone like her in your corner is really important. So we'll make sure we get everyone Lori's contact information as soon as we're done. So Allison, thank you so much for also being here. So now we're going to turn towards Social Security. So just as a high level, it's always in the news. Excuse me. People know that they're going to get checks when they reach a certain age, but Social Security is perhaps even more complicated than Medicare in certain aspects. So let's just start with kind of a brief overview of what Social Security is, what it's there to provide, and how the program actually comes together.
Yeah, absolutely. So Social Security is essentially a government-sponsored pension that you're funding in a job that pays into Social Security taxes. So to be a fully insured worker in the eyes of the Social Security Administration, you need 40 quarters. So that's 10 working years in a job that pays into Social Security. And the way that they're going to calculate it, we'll go into a little bit. But I want to touch on what it's going to provide you. So it's not just retirement benefits for yourself. It's going to be longevity projection, which means looking out for how you're going to live off of Social Security, how you're going to maintain surviving in retirement. It's going to be the bulk, most likely, of your retirement paycheck. So being able to protect not just yourself, but your spouse when you pass away, looking at spousal coverage for just a spousal benefit. Now we're looking at a survivor benefit, but say you are the higher earning spouse, your lower earning income spouse is eligible for a maximum of 50% of your full retirement age benefit. It's huge. It's definitely going to provide additional income for a lower earning spouse. But looking at different factors that come into play for Social Security are going to be cost of living adjustment. That wasn't initially introduced in 1935 when President Roosevelt introduced Social Security. It came later in 1950, and it wasn't guaranteed. It had to be a special case. Now, later on, they introduced that cost of living adjustment is not guaranteed, but it is, in the years that it's announced, going to be added. So once you reach age 62, the age of entitlement for Social Security, until the age in which you file, they're going to average out those cost of living adjustments that are announced if they are in that time frame. And that's what's going to be applied to your full retirement age benefit. Family benefits, so looking at dependent benefits, dependent care. If you have a child that's either mentally disabled, physically disabled, or under the age of 18 when you file for Social Security, they may be eligible for their own benefit on your working record. And then disability benefits. So if you qualify for Social Security supplemental insurance, that would be given through the Social Security Administration as well.
This is all tremendously helpful. And let me just ask a quick follow-up question as I was listening to your really excellent explanation. The interesting thing, and we're going to touch on this on this slide as well, but can you just discuss a little bit about the benefits for a spouse along a couple of parallels? So I believe it's gender neutral, and you don't actually still have to be married. So what this is really there for my understanding, and I think everyone will really benefit from understanding, is that this is for potentially for a spouse that was a homemaker or who doesn't have those qualifying quarters. They are entitled to the working spouse's a benefit on their record, correct?
Yes, absolutely. So what's important to note, if the spouse didn't work at all, they have no working history, they're eligible for up to 50% of the working earner's retirement benefit as a spousal benefit. What's also important to note is they would be eligible for a survivor benefit. So in looking at what that person was earning at the time of their death, that's what the surviving spouse is eligible for. So it's something that not a lot of people thought about before, but now with life expectancies increasing, people are really diving into looking at what it's going to mean for the lower earning spouse when they pass away. And so who's eligible for retirement benefits? So it's the individual worker, it's your work record, your work history, looking at a spousal benefit on your record, looking at an ex-spouse. So if you were married, you have to meet specific criteria to be considered eligible for divorce spousal benefits. It would be 10 years married. And there's a great caveat, if you're divorced for 2 years, you're then considered an independently eligible divorce spouse, which opens up even more filing options for you. You don't have to wait for your husband to file, for your ex-husband to file for his benefit. If you've been divorced for 2 years and you meet all of the other criteria from the Social Security Administration, you're then eligible to file for your benefit without him having even filed yet. And then spouse survivor benefits. So looking at if your higher earning spouse delayed until 70, the lower earning spouse, when that higher earning spouse passes away, they're eligible to delayed retire credits as long as they file at their full retirement age for survivor benefits. And I like to point out, so for number 4, survivor benefits, you can't receive, or you're not going to receive, your own retirement benefit or your spousal benefit and the survivor benefit. Once that spouse passes away, you're only eligible for one benefit. So you really need to plan and work with your advisors to see what's going to make up for that difference and that huge loss of income when one spouse passes.
No, that's really helpful. And I also want to point out, and this is something that I believe you touched on, is that, and it's right here on the screen, that over your lifetime, you're going to fall into multiple categories potentially. So it really is important to know exactly what you can expect. And to your last point, which is probably most critical, people get accustomed, especially, 2-income households or a household that has multiple benefits at the same time. That does not continue in perpetuity should one spouse pass away. So that's an excellent reminder to really understand what your cash flow looks like, what your expenses are, and be appropriately prepared for when that day actually arrives.
Absolutely.
Okay, so let's just talk quickly about how benefits are actually calculated. They're one of the biggest questions that we receive on the advisor is, quote unquote, when do I take my benefits? And it's important to know that there are breakpoints at a variety of ages, but can you just walk us through how the benefits are actually calculated and what are some of the important decisions that you should consider when deciding to elect a benefit or defer to a later year?
Yes, absolutely. So when you work in a job in the public sector, you are not contributing into Social Security taxes. So that would be a non-covered pension. That's definitely something that you want to remember as well. If you work in the private sector, you've worked in a job that collected or withdrew Social Security taxes from your pay. So for those years that you've earned Social Security, when you retire, you're eligible for a benefit. In order to be eligible, you have to have those 10 working years. And what they'll do is look at the job that you worked in, the top 30, and they will find your primary insurance amount. That's what you'd be eligible to receive monthly from Social Security when you reach your full retirement age. Full retirement age is completely dependent on your birth year. And a lot of people find or assume that you're going to get the most out of Social Security if you wait till 70. You're going to get the least that you possibly can get if you file as early as possible at 62. The 62 is the year of initial eligibility for Social Security. Well, there's a lot that comes into play. Everybody's work history is different. No two work histories are going to be the exact same. Even if they were very similar, their birth dates may be different. So somebody may be looking at that year is going to make or break how you're calculating that benefit amount. So for example, if you look at the chart over here, we have anyone that was born before 1954, their full retirement age was 66. So what that means is they have 4 years that if they delay till age 70, they would have 4 years of inflation added. That's called delayed retirement credit. And if they were to file, say, at 62, they would have a high reduction. And what that means is you're going to have that benefit amount reduced for your lifetime. That's the lowest that you're going to be eligible to receive. And it's going to have an impact on not just your benefit, but auxiliary benefits. So people that are collecting benefits on your behalf, that's going to reduce what they're eligible to receive. And then those delayed retirement credits are huge. So those are guaranteed increases. Social Security COLA is not guaranteed. It's great in 2022. It's going to be 5.9%, which is a big jump for 1.3, which was last year. It's great, but there's years where it's 0%. You're guaranteed delayed retirement credits from the time that you reach your full retirement age every single month that you wait until 70. So it's 2/3 of 1% that's increased on your PIA, your primary insurance amount, and it's going to max out at 70. And that's something to think about, especially for survivor benefits, because if you're the higher earning spouse, those delayed retirement credits are going to be eligible for the surviving spouse to receive, so long as they file at their survivor full retirement age. There are 2 different full retirement ages that I think not a lot of people realize when they're doing their initial Social Security planning. You have your retirement full retirement age, and then you have your survivor full retirement age. So if you were to collect before your survivor FRA, they would reduce your survivor benefits, including those DRCs. So putting all of these pieces into the puzzle can be completely complex. And I always recommend working with an advisor, using software, and looking at all of the different strategies that are available to you specifically, because no 2 cases are the same. No 2 work histories are the same. No 2 people have the same birth dates. You may have similar birth dates, but you're not going to have the same benefit amount. So definitely look at every option that's available to you, because oftentimes it's way more complex, especially in a couple, to try to maximize that benefit. You don't want to leave money on the table.
No, I absolutely. And one point I want to reiterate is that there are cases in which spouses are born in different birth years. So taking that into consideration, really understanding how delaying you taking Social Security is going to have that downstream impact that you talk about. Those are all real considerations. And, Life Yield, where Allison is the Social Security expert, really has some great tools that we can utilize to help you answer those complex questions. Okay, so thinking about the kind of commonly asked questions about Social Security, and some of these you've already touched on, but it'll be really good to kind of go over them in more detail. So maximizing my benefit, what's the best way for an individual to go about maximizing their benefit?
So to start, you definitely want to make the most informed decision possible. So starting the planning process early. Don't wait. It is definitely an intimidating conversation, but what's great with certain softwares that you can sit down as an advisor, your advisor at 12 Points, and just go through the different options that are available to you. You don't have to make a decision right away, but you want to just talk about Social Security, because that's the starting point for retirement. It's going to be the basis that you may rely on. You may be fortunate enough to not have to rely on it, but it still is going to be a huge component to that retirement paycheck. And delaying is definitely an option, but always knowing that once you reach FRA, every month that you wait, you're getting an increase. So waiting as long as you can. That doesn't necessarily mean waiting all the way to 70, but it can mean adding as much as you possibly can to that base amount, your primary insurance amount. And also something that I think a lot of people don't know is that when you are attaining or getting these early retirement credits added to your records, they're not actually added by the Social Security Administration until the January of the year following that you've earned them. So you may look at your record and they're not there, but you have earned them. Once you turn 70, they will all be available the day that you attain age 70.
Really helpful. So what would cause and I know you've touched on these in bits and pieces, but what factors kind of generally would cause a reduction in benefits? And specifically, can you just further explain the public pension offset? I think that's a helpful tip for anyone who may have a spouse who is a public sector employee.
Yeah, absolutely. So that would be a non-covered pension. So that is a job that did not pay into Social Security taxes. So that would be a private pension. And what's great is a lot of tools allow you to enter that information in, and it's going to reduce that Social Security benefit. Sometimes it wipes it out, but the way that it will calculate it behind the scenes for you so you don't have to worry about what that's going to mean, you'll just be able to see what the end result would be. But it's important to know that it's not just your own benefit that would be reduced if you had a private pension. It's also going to reduce any benefits that you would have for survivor benefits on your spouse's record. Knowing that it's going to reduce that and it could wipe it entirely, you definitely want to make sure that you're making the most informed decision. Another reduction would be for filing for your own retirement benefits as early as possible, age 62. That's the highest reduction. Or filing for a spousal benefit before your full retirement age, that would be a reduction. And then another one would be if you file before your survivor full retirement age for survivor benefits, they're going to reduce that benefit as well.
Really helpful. So thinking about perhaps a couple that has a deviation in age from one another, can you still maximize your benefits if one spouse has already filed?
Yeah, definitely. I always recommend running those scenarios. I think that it's not just, well, my husband's already filed, so I'm just going to file for my own. It doesn't really make a difference. You don't really realize how many different strategies are available to you until you really look at them all. And there are different ways and different timing that would help you maximize that benefit.
Excellent. Okay. And then I'm going to combine the last two into a single question, because I think the mechanics of this, right, how you actually go about applying, collecting, et cetera, are kind of interwoven, and I think would be helpful to hear as a pair. So when first of all, how do you actually apply for benefits? And then how can you submit, and how do you actually go about receiving your check, direct deposit, et cetera, when you actually, submit your application?
That's a great question. The Social Security Administration always recommends applying no more than 4 months in advance. So the earliest that you could ever apply would be 61 and 9 months. And you aren't getting that Social Security check until the month after it's due. And right now, due to COVID, the way that the filing process has changed, the offices are actually closed to the public. There are still Social Security representatives there, but they're only able to be reached by phone. You can apply for all benefits except for survivor benefits online. You can just go right to your Social Security account, myssa.com, and you're able to apply online. But if you are applying for a survivor benefit, you have to call them. That number is there as well, so they're able to help you through the process. But everything else, they highly recommend doing online. My recommendation is once you've decided on how you want to file, emailing or contacting a Social Security representative at the office and asking any questions that you have, ensuring that all of the information and the way that you would like to file is being verified by them. Sometimes you have to reach 3 or 4 different representatives to get the correct answer, but that's because they're not able to give you advice. That's why it's great to work with a financial planner or an advisor, because they're able to have that benefit. Social Security Administration is only going to give you, this is what you're due at your full retirement age. If you file early at 62, this is what you're going to get. If you wait till 70, this is what you're going to get. They're not able to tell you all of the different ages in between, all of the different strategies. They're not trying to help you get the most out of it. That's why it's great to make the most informed decision that you can and apply with a well-informed thought process.
That's a great point. And I'll just share it kind of anecdotally, a similar situation in which we had a client who was taking advantage of one of these strategies, and we spoke to 4 different representatives who all gave us, different answers. So just be mindful of who you speak with. Make sure your information is recorded, and if you can, really do your own personal due diligence first, so you're being more direct with the end representative as opposed to thinking about a way to get their feedback, because they're really not equipped to really help you. So that's an excellent point. Thank you, Allison. So obviously these 2 programs work together, and I want to just touch on briefly kind of how we can answer some questions. So Lori, I actually have one for you. Is that we often get folks who are potentially helping their parents apply for this. What's the best way for someone to actually go about applying for Medicare in terms of mechanically, physically able to do it? And then is someone able to assist them throughout that process, or are they going to have to be an active participant in applying for their benefits?
Okay, so if you are enrolling in Medicare during your initial enrollment period, which is the 3 months before you turn 65, the month you turn 65, or the 3 months after 65. You can do that online through the ssa.gov website. If you have delayed enrolling in Medicare, if you've enrolled in Medicare Part A only and need to enroll in Part B, you used to have to go to the Social Security office to do that, but as Allison mentioned, they are still currently closed. So what I recommend is there are certain forms that need to be completed. One is the Part B application. The other is a form that has to be completed by your employer to prove that you've had healthcare coverage through the employer. Fill out those forms, make copies, send them to the your local Social Security office by certified mail. So by sending it by certified mail, you're starting to create a paper trail to show that your forms have been delivered. Once you receive the information that yes, your forms were delivered, I then tell my clients to call the local Social Security office to make sure that they have the forms, and that also, updates the paper trail that you have a phone call also into there.
Okay, that's really helpful. And Allison, one for you. Someone asked, I've already submitted an application for benefits, but realized that I've made a mistake. Can I undo my application?
You have the ability to do it once in a lifetime. It has to be within the first 12 months since you applied. But you do have the option to do an essential do-over. You can withdraw your application, and oftentimes they do require you to, if you've already received multiple months of benefits, you will have to pay them back.
Okay, really, all really helpful. So everyone, I want to thank Allison and Lori specifically for their time. As I promised at the beginning, everyone who's been on the webinar and for all our other participants, you'll be receiving all of their contact information. How Medicare Associates is really Lori is such a wonderful resource, and I just want to thank you so much for your time. Allison, you as well. LifeYield, which we are a subscriber to here at 12 Points, we utilize all of their tools to really get us in the best possible place for all our clients. So both I really want to thank you very much for your time. The idea that I was going to have this level of expertise on my own is laughable. So your wisdom as guidance and is greatly appreciated. And I would encourage everyone, please reach out to them if they have any other questions at all, or to us, we'd be happy to connect them. But they're really the experts who make these this engine go. So thank you both very much. Thank you everyone in attendance. We'll be sure to send all that contact information out, as well as a copy and recording of the webinar. So if anyone has any questions, feel free to reach out and we'll connect to the appropriate party. So I promise you we'll be done before 1, so I'll give you 5 minutes of your day back. Thank you very much for everybody, and everyone have a wonderful week.
Bye.
Thank you.